Hello, I'm Dr. Purvi Kadakia Kutty, Consultant Pediatric Hematologist and Oncologist at Apollo Hospitals, Mumbai. Today, on the occasion of World Hemophilia Day, which is celebrated every year on 17th April, we like to create awareness about hemophilia and all inherited bleeding disorders, not only among the patients who are suffering from these diseases, but also amongst the healthcare providers, so that there is access for all. Hemophilia is an inherited genetic disorder in which the body's ability to form a stable blood clot is impaired. A very interesting fact about hemophilia, it's also known as Royal's disease, as Queen Victoria had passed the mutation of hemophilia B to her son. So, this disorder affects mainly the male borns. It is present from birth and it remains lifelong. Since the body's ability is impaired to form stable blood clot, there is excessive bleeding in response to trivial trauma, or sometimes there may be spontaneous bleeding. There are two types of hemophilia. Hemophilia A, in which there is deficiency of clotting factor 8. Hemophilia B, in which there is deficiency of clotting factor 9. Now, what are the signs and symptoms of hemophilia? There is excessive bleeding, which may be spontaneous or response to a small injury. Delayed bleeding is usually the norm in hemophilia or inherited bleeding disorders. There may be bleeding into joints, and chronic joint bleeding can lead to joint damage. There may be bleeding into internal cavities and brain hemorrhage, which can be fatal in 1% of the cases. Hemophilia is diagnosed by simple laboratory blood tests, which are sent to a specialized coagulation lab, where we pick up the deficiency of the clotting factors. Since this condition is present lifelong, it impairs the quality of life, and there is no cure for these disorders. However, the symptoms may be controlled either when there is an episodic bleeding or preemptive or preventive control by replacing the deficient clotting factors. Some of the myths of hemophilia are that even though it is an inherited bleeding disorder, 1/3 of the cases may not have a family history. This disease is not infective and it is remaining lifelong, so the symptoms may occur anytime. Hemophilia does not cause HIV. In fact, nowadays, highly purified recombinant blood factors are available, which are safe. When left untreated, hemophilia can lead to early death. As discussed earlier, treatment of hemophilia involves injecting the missing clotting factors. With this video, we at Apollo Hospitals, Navi, Mumbai, wish to create awareness about hemophilia. Thank you.